if a huge sum of money is spent on administrative costs, it means that this objective will not be realized. Already, we have some information that the salary of the Director General of the National Health Insurance Management Authority is 170,000 kwacha per month. And if this is true, how much will be spent in total on personal emoluments when the full establishment of staff is employed? In any case, how can a health scheme that is meant to benefit members of the general public pay a huge salary of this much?
The Zambia Federation of Employers makes observations that enforcing the National Health Insurance Scheme under the current scenario as projected by the Ministry of Health may attract more expenses on the part of government. The board put in place alone is feared to cost Zambians thousands of kwacha. Federation Acting President Stephen Sikombe has since appealed to the government to halt the implementation of the health insurance scheme.
If the Minister of Health, Dr. Chitalu Chilufya, means well with the introduction of the National Health Insurance Scheme, he should be open to meaningful dialogue with the key stakeholders on this issue so that we can move together to raise the dream of universal health coverage. Failure to do this, the National Health Insurance Scheme is going to fail, as compliance levels are most likely going to be very low.
The employers are also concerned in the manner the Ministry of Health is trying to enforce the scheme without answering to serious concerns raised by both employers and trade unions.
Surely, is the minister respecting the role that the employers play in this country or the role that the labor movement plays in this country? He's not. And he wants to deduct money from our employees. Who will be deducting? It's the employers who manage the payroll. He wants the employers to make a contribution, but he doesn't want to speak to us. Surely, is he being fair? Can't the minister just find the room in his busy schedule and invite us to a table and discuss this matter so that we could agree on something? We also have proposals which we've made in that position paper, which has gone to him and is sitting on his table. Why is he ignoring that? So we find that to be very, very unfair. And in fact, unprofessional. It's an unprofessional way of handling a national matter. It does not only affect him, it affects everyone.
Meanwhile, the Professional Teachers Union General Secretary, Kangwa Msenge, has called on government not to implement the scheme, but allow for further consultation on the matter.
Accreditation of health scheme providers who should be gazetted and the list of such providers be published in the daily papers for knowledge and information of members, without which contributing members and or their dependents shall have no access. The undertaking of the public education and awareness programs on health insurance, this is key if the health insurance scheme is to be accepted by the intended beneficiaries. The scheme risks being rejected or frustrated for lack of knowledge about its benefits and may attract unnecessary political criticism. The Scheme Management Authority does not yet.
The National Union of Public and Private Educators of Zambia, NUPES, on the other hand, feels that the health insurance scheme needs to be enforced as it is long overdue.
The benefit package, will not deal with the workers only, but including my own grandma out there in the village, my own uncle out there in the village will benefit. It's not about me who is still in employment alone, but including those that, are not working, except that those who are criticizing are looking at it from a worker's point of view alone.
Serious concerns have been raised as regards the implementation of the health insurance scheme, with stakeholders in the labor movement charging that the scheme is being rushed to implementation without answering to questions as regards the fund manager and the benefits that come to those that contribute to the scheme. Mwapek Mwenda, Prime TV News, Lusaka.